Why is learning CPR important? CPR is a lifelong skill. You never know when you will encounter a situation or where you will need it. Sudden cardiac arrest can and does happen to people of all ages. You want to be prepared with the knowledge and skills necessary to help sustain life until paramedics and advanced medical personnel arrive. Why is our high school doing this? A law has been passed stating as of the 2014-2015 school year, all high school students in the state of Illinois will be trained in CPR and AED skills.
What does a cardiac emergency look like?
Difficulty breathing,
Lightheadedness,
tightening of the chest,
sweating and heavy breathing that does not subside with rest,
sudden unconsciousness,
When do you call 911? Anytime someone becomes unconscious, whenever someone is having difficulty breathing, when someone is showing any of the signs stated above, when you know a victim has a heart condition and is experiencing chest pain or difficulty breathing, when you are alone or no one is available to help.
Mr. Foster? Yeah. What is hands-only CPR?
Basically, it involves calling 911 when somebody is unconscious, not breathing, and providing continuous chest compressions until you can't provide them anymore because you're exhausted, or an AED arrives, or medical personnel are there to relieve you.
Why is hands-only CPR training a viable CPR method? And it's because we can get multiple people, bystanders, to be able to function and help someone in a cardiac arrest situation.
It is a simple skill that people of all ages can learn and implement when needed.
How is hands-only CPR different than other forms of CPR?
Well, it is just that. It's hands-only, so you don't have to provide respirations or breaths in combination with compression, so bystanders are more likely to assist and help you when needed.
You also don't need breathing barriers and are less likely to transfer infectious diseases.
How to perform hands-only CPR. Cardiac emergencies can happen anywhere. Be prepared with a simple technique known as hands-only CPR. You can learn it in minutes, it's easy to remember, and it can help save a life. You will need the willingness to act and a few simple skills. Whenever possible, use disposable gloves when providing emergency care. Step 1. If you see someone suddenly collapse, check the scene for safety and then see if the person responds to you by tapping them on the shoulder and shouting, "Are you okay?" Step 2. Briefly look for breathing. Step 3. If they don't respond, call or send someone to call 911 or the local emergency number right away. Step 4. If the person is not breathing or is gasping, prepare to give chest compressions. Kneel beside them and put the heel of one hand on the center of their chest. Place your other hand over that hand, lacing your fingers together. Position your shoulders directly over your hands, keeping your arms straight and your fingers off the chest. Step 5. Push hard and fast, at least 2 inches, then let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Step 6. Keep going. Do not stop compressions until the person shows an obvious sign of life like breathing. The scene becomes unsafe. An automated external defibrillator or AED is ready, you're too exhausted to continue, or a trained responder takes over. Step 7. Get training and encourage others to do so by taking an American Red Cross health and safety course. Knowing full CPR, chest compressions, and breaths will enable you to help in other emergencies such as drowning and choking. Every household should have at least one person trained in life-saving skills. Did you know? Most people who survive a cardiac emergency are helped by a bystander. To find your local Red Cross chapter, visit redcross.org.
What if the person is face down? Check for responsiveness. If they do not respond, roll the victim onto his or her back and check for breathing.
What if I am alone? If someone suddenly collapses and is unresponsive, call 911 first and they will instruct you on how to proceed.
What if the person vomits? Roll him or her quickly onto his or her side, supporting the head and neck. Wipe person's mouth by doing a finger sweep. Roll the person back on his or her back and continue giving compressions if still unconscious.
Can hands-only CPR be used on an infant or child? Would I push as hard? Yes, it can be used on any age victim that is unconscious and not breathing. You would compress slightly less on a young child or infant.
Does the person need to be on a firm, flat surface? Yes, compressions are most effective when performed on a firm, flat surface.
What are agonal gasps? Isolated or infrequent gasps that can occur after the heart stops beating. These should not be treated as breathing, and compression should be performed.
Automated external defibrillator is a device that provides an electronic shock to the heart in order to stimulate it to beat at a regular pace.
It analyzes the activity of the heart to determine if a shock would be appropriate. It would not provide a shock if the heart is still beating, so there's no way that it can mistakenly cause harm.
When a victim is unconscious and not breathing, an AED should be utilized if available.
Open the AED and follow directions it provides for proper pad placement. It will direct you on how to proceed. Be sure to keep yourself and others clear of the victims while it is analyzing and providing a shock.
AED use is one way to prolong life in case of a sudden cardiac arrest. An AED has the power to stimulate a heart that is not beating in the proper pattern to return to a more healthy rhythm.
open package and remove bag. Tear open package and remove bag. Tear open package and remove pad. Peel one pad from plastic liner. Peel one pad from plastic liner. Peel one pad from plastic liner. Place one pad on bare upper chest. Place one pad on bare upper chest. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown. Peel second pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing button to deliver shock. Stand clear. Shock delivered. It is now safe to touch the patient. Give 30 compressions. Then give 2 breaths.
So what are some safety concerns for AED? We want to make sure that you don't want to touch the victim while the machine is analyzing. You definitely don't want to touch it while it's giving shock. And then you want to make sure that you don't use it in a moving vehicle or in standing water cuts.
What if the victim is hairy? Use the razor found in the AED to do a quick shave of the area where the pads are to be placed. What if the victim is wet? Dry his or her chest in order for the pads to adhere to the body.
No, the AED will not provide a shock to a heart that is beating properly. Instead, you will hear this from the machine.
No shock advised.
You should provide care using the skills you're certified to provide. However, hands-only CPR is the minimum that should be provided.